The Institute of World Affairs at the University of Wisconsin-Milwaukee presents International Focus, a weekly discussion of the people and events behind today's global headlines. Support provided by Milwaukee Public Television and the UWM Center for International Education. Now here's your host, Doug Savage.
Welcome to International Focus. In a perfect world, where we live or how much money we have wouldn't impact our ability to enjoy a healthy life. In reality, of course, unequal distribution of money, power, and resources at the global, national, and local levels has a profound impact on the conditions in which we are born, live, work, and grow old. These social determinants of health, the economic and social conditions in which we live, have a significant impact on our vulnerability to disease and likelihood of injury. Advocates for health equity suggest this unequal distribution of health-damaging conditions is not a natural phenomenon, but the result of poor social policies, unfair economic arrangements, and bad politics. To help us explore how communities might come closer to giving all their members a chance at living a healthy life, we're joined today by Susan Kim, Deputy Director of the O'Neill Institute for National and Global Health Law at Georgetown University. Trained in law, public health, and business, her research focus includes public-private health partnerships. Well, Susan, welcome to Wisconsin and International Focus.
Thank you very much.
I'd like to start, if I could, with a quote from Michael Marmot, who is president of the World Medical Association. It's a quote from a recent edition of The Lancet, and he says, "The gross inequalities in health that we see within and between countries present a challenge to the world. That there should be a spread of life expectancy of 48 years among countries and 20 years or more within countries is not inevitable." So, is he right?
I think Dr. Marmot has a good point. I don't think it's inevitable. I do think, however, we have sort of shrunk the gap in recent times, so that's positive. But I think there's much more that we can do to sort of shrink that gap.
So, let's look. Sierra Leone, life expectancy in the mid-40s years of age versus Japan, 84 years. And in our own state of Wisconsin, the white population has a life expectancy of just over 80 years, while African Americans have an expectancy of 6 years less, at 74. So, what are these factors? I mean, if it's not just sort of biological, what?
Well, I think probably it goes back to sort of, the whole traditional conventional wisdom of environment, sort of nature versus nurture, right? Environment and genetics. And so part of it, I think very much, and what I think Michael Marmot is alluding to is sort of the structural sort of determinants of health. And this includes the social determinants and sort of the physical determinants. I think obviously geography is sort of one important thing. Japan sort of is geographically sort of different than where Sierra Leone is, history, in terms of civil sort of unrest, poor leadership, weak political will, and resources, right? I think, and so, many things I think sort of happen historically over time. And I think so much of it is beyond sort of our control and individual genes. And I think there's not enough attention sort of given to those sort of more structural elements of what determines sort of health outcomes.
So as a policymaker, can I just throw up my hand and say, we know poverty is bad for you, and so what are you going to do?
Well, I think that is, no. I think, one, we really sort of need to take a different approach and really sort of drill down deeply into what are the underlying causes of poverty. And it's much more than sort of unequal distribution of resources, what is not just sort of in the United States, but sort of globally in terms of what sort of is in the context of poverty, how do people sort of emerge from poverty, and really sort of understand those communities better. I think so many of the times sort of the policy approaches that we have towards, I think, either sort of health outcomes or poverty tend to be from a very sort of high level, 30,000 feet, instead of sort of really drilling down and understanding sort of what's going on in the communities.
So, if poverty writ large contains a lot of these social determinants. Is it possible to close that gap without really addressing poverty at that most basic level? I mean, can we have income disparity but not as yawning of health disparities?
I think that's possible. And I also think money is important. So money and financial resources are important, but that alone will not close the gap. And I think part of it is really taking a much more holistic look in sort of just financial resources, but the sort of structural context. And this is sort of your neighborhoods, your laws, your schools, and what is sort of your governance structures. And this is sort of, it needs to be much more than just what are the resources thrown at something. I don't think, in the global context, there has been a significant amount of development dollars. And yet, I think the return sort of on those development dollars has been limited because we aren't sort of really comprehensively looking at our programs, either in health or in poverty, to think about how do we sort of get to where we want to be.
So is just our development model flawed with regard to the outcomes we're looking at in terms of health?
Some of it, but I think we're getting better. I think I'm not sort of a development historian. I think other folks have done this much better. But I think it's only been very recent when people have really started to work in partnership with countries and sort of this notion of country ownership and community ownership to really figure out how do countries take the lead and how can wealthier developed nations support them sort of in this path to prosperity, to better health, etc.
So, there have been some critiques of the IMF, for example, and say those kind of structural adjustment programs typically lead to things that create the kind of social determinants that create, in turn, the kinds of disparities in health. Do you think that's right?
Well, so I'm not, again, an economic expert. I do think, obviously, within the context of our economic sort of structure, which is now a global sort of economic structure, there are definitely things that can sort of exacerbate inequality.
So your institute is National and Global Health Law. So talk a little bit about the role the legal framework plays in all of this.
Sure. So we take a sort of broad-based public health, global health-based approach, and our goal is really to think about how can the law play a role in improving health outcomes. And essentially, it is not just sort of in the context of healthcare or malpractice or health reform, but really sort of more comprehensive, sort of more holistic, sort of from what are the underlying legal frameworks a healthy society needs to have. And this includes regulatory systems, it includes sort of constitutional processes, and it includes sort of recourse when sort of things go wrong.
So give me an example. I mean, like a place where you're active and what kinds of things might you do?
So, for example, we work often closely with the World Health Organizations and regional partners. One of the projects that we have is with EMRO, the Eastern Mediterranean Regional Office, and we are working with them to develop a public health law framework, sort of to achieve their regional goals. One of the things they're very much focused on is reducing the burden of non-communicable or chronic diseases in their region. And what are some of the legal mechanisms, best practices from around the world, either in sort of obesity prevention, tobacco control, and how can that influence their particular region?
So who would you work with directly?
So we work in EMRO, we work with sort of their Director General, who runs sort of that office, and his sort of team on NCDs. And basically we work with them. They obviously sort of are the science experts and the sort of cultural context experts. And sort of we provide the analysis in terms of what has worked best, for example, in tobacco control. What has worked best? What might be sort of applicable? And then sort of their legal sort of experts as well work together with us to sort out, what is possible within their sort of regional frameworks or their country frameworks.
So, how does it work with very different national legal systems? I mean, if there are legal approaches to tobacco control. I mean, how might it play out in one system versus another? I mean,
So overall, I think when you think about legal frameworks, typically the state tends to have, or the country tends to have similar powers, right? Most countries, the governments have the power to tax, the power to sort of impose restrictions on marketing and advertising. And one of the things is, for example, if we're sort of going to continue with the tobacco control, is the WHO has a treaty that is binding on all of its member states, the Framework Convention on Tobacco Control. And countries that have ratified that by signing on have agreed to implement that into their national law. And there are very specific metrics in terms of regulation of the product, sort of banning sort of the product in public spaces, how to ban marketing and advertising in sort of sporting events or marketing and advertising to children, etc.
so who would the counterparts be in terms of just, what kinds of people at the country level would be working with you?
So typically, it sort of varies. I think in what we have found at the Institute, and one of our goals is really to sort of build this legal capacity. Often, what we find in ministries of health in these countries typically either have one attorney sort of overseeing the whole ministry, or they don't have anyone. And it's really somebody that is kind of just trained and is familiarizing themselves with the vocabulary. And that's fine. You don't have to be an attorney. And then more often than not, it tends to be NGOs. So non-governmental organizations, advocacy organizations really sort of pushing this forward. And in very specific, I think, areas, tobacco for one, there's quite a bit of donor funding that really sort of believes this is a very important public health issue. So Bloomberg Philanthropies has really invested a lot into this and is supportive of sort of countries building sort of this capacity.
So, you mentioned ministries of health. I mean, is the approach often much more epidemiological? I mean, this notion of social determinants, is that something that you find is generally accepted elsewhere in the world? Or if I'm in the Ministry of Health in wherever, am I thinking more about clean water than these other factors?
So I think it is becoming more accepted because as in the health context, folks really understand that it needs to be multidisciplinary. But in any context, rich or poor country, institutions and governmental agencies have priorities. I think we could do a much better job of not being siloed in each agency or in each sort of organization. And I think you're really starting to see this happen. And there seems to be a great opportunity in the global health context because we are sort of transitioning from vertical health systems, so disease-specific health systems, to horizontal health systems. And they actually may get farther along, I think, than the rest of us that already have sort of our health systems. So I think maybe we can be optimistic.
Well, I'd like to talk a little bit more about, who should be at the table going forward. First, we're going to take a short break. We'll be right back.
The Institute of World Affairs presents our community with a range of public programs relating to global issues, U.S. foreign policy, and the world economy. For more information about the Institute of World Affairs, call 414-229-3220 or visit our website at www.iwa.uwm.edu.
Welcome back. We're discussing inequity and inequality in health with Susan Kim from the O'Neill Institute for National and Global Health Law at Georgetown. Well, so we're talking a little bit about who your institute may work with typically. At the broadest level, if we're really going to address these social determinants of health inequity, who needs to be at the table, do you think?
So I think that is probably what makes this very challenging, because when you're talking about social determinants of health, you're talking about everything. So in an ideal world, you would have affected communities, you would have policymakers, you would have people, private sector, advocates, people with money, and so it becomes very challenging, I think, to convene all those people, but ideally you can't really address the social determinants of health in a comprehensive way without having everyone at the table.
So how do you go about doing that?
Well, one, I think, is more, you need to sort of be open-minded. Obviously, there are sort of challenges in terms of engaging with different sort of sectors and how do you sort of overcome those. But one is, I think, to be open-minded. One, I think, is to ensure that there is greater transparency in these conversations and that, affected communities are included in the dialogue. And sort of if you are, for example, engaging with the private sector or with industry, that it's very clear sort of what is sort of on the table.
And we talked at the outset about the differences between countries, but also within communities, and sometimes within very small communities there can be significant differences. Is the process different when you're talking sort of intra-community?
Well, I think probably not, in the sense that, so one, I think you start with the science to understand really the context very clearly. And then you also have to understand the community. And whether sort of it's global, whether it's sort of intra-community, you need to have ownership within the community of that problem. And so it requires the power of the process in talking and engaging folks and sort of getting a sense of what their understanding of the problem is and including them as a part of the solution.
So, it seems to me it operates on several levels. There's certainly the medical component of it. I mean, just the transmission of communicable disease, for example. Then there's the societal, things like safety and education and work. But what about the personal? I mean, how do you address just lifestyle kinds of things?
Well, I think part of the challenges is many of our solutions to a lot of health issues tend to be focused on individual behavior. And I think this has to do with, that tends to be the most straightforward intervention. I think what's harder to understand, though, is individual behavior is influenced by sort of infrastructure. In the context, for example, of food, I think people are like, well, if you want to decrease obesity, it's really about calories in, calories out. So better nutrition, greater physical activity. The harder thing, I think, is really thinking about, well, food companies are literally bioengineering food to sort of be responsive to the same neurotransmitters sort of in your head, that, sort of the sense, I believe sort of it's sort of the opioid sensors, so the pleasure sensors, and sort of in terms of how much, I think, of your individual behavior is influenced by external influences and how predictable we are, right? So when you think about, and no one is better at exploiting data than the industry, so that when you walk into a store, as soon as you walk in, the store probably knows exactly what the 5 items you're going to walk out with. And I really think if we could emphasize more focusing on those structural elements rather than just focusing on, eat less, walk more, I think you might see sort of a better return.
So then that suggests at some point there might be an inherent conflict if we're trying to structure the regulatory environment and some of these other social determinants in a way that says maybe that bag of salty, crunchy snacks is not the best thing for you. Do we run afoul of the people whose livelihood depends on getting you to eat more salty, crunchy snacks?
Well, I mean, yes, but I also think the industry is very focused. Their motivation is profit. And ultimately, if you can sort of find alignment in terms of you can make money by promoting healthier options, whether it be in food, whether it be in sort of urban design, whether it be in any sort of product development, I think they will sort of follow that trend. They're very, I guess, for lack of a better term, pure in their motivations. But it really is figuring out and also sort of finding the right vocabulary to sort of encourage them to focus on health rather than the other thing.
So can you give me an example of where that's happened? I mean, like sort of your perfect case scenario where everybody just fell into line and you know.
Well, I don't know if there's a perfect case scenario, but you actually do see it a lot in food, right? Because they know, and they've been watching, I think, the tobacco example for the past, half a century. And they also understand right now sort of us, the conversation is focused on reduction of chronic diseases. And they, the savvier companies are really sort of voluntarily reducing their portion sizes. I think soda companies that are doing this are really starting to move away from the trans fats. I think that's been going away for a while. And so it really is, I think sort of their behavior can be compelled by sort of what public sentiment tends to be.
And we've been talking a lot about disease, but there's another source of fatality, and that's just injury. How does this play into that? I mean, what are some of the social determinants that decide whether or not I'm likely to be injured or not?
Well, similar to, I think, what we've been talking about. So in terms of, your structural environment, what kind of sort of a neighborhood do you live in? What kind of roads do you have? What kind of housing do you have? And so obviously the vulnerable populations tend to be living in sort of the poorer communities, both domestically and internationally. And I think injury sort of is a great public health concern. And it's probably one of the leading causes of sort of global and domestic morbidity and mortality.
So how do you bring the most impacted people to the table?
Well, I think an easy way is to invite them, right? In many of the conversations that happen sort of, behind closed doors or at senior level, they're just not in the room. And I think, a good first step is, one, to invite them, and two, to go out into the community and really listen to people. I think public health often sort of struggles with that. We are getting better because I think we realize that sustainable health solutions really come when they're owned by the community. But I think, yes, to make sure that they're at least present is a good first step.
And do you ever find, particularly, when you're working globally outside the U.S., is there a resistance to bringing those people in? I mean, if they're marginalized to begin with, perhaps they're not plugged into the power centers of that government, and so it's like, well, you don't want to talk to those people.
Right. I think it depends on the context. I think, well, for the most part, what I found in the global health space, we have very strong advocacy, for one of the areas I work on is sort of HIV. And so you have very strong global advocates that really support marginalized communities, be they sort of LGBTI, be they sex workers, injecting drug users. And they find safe spaces for them. And, large international organizations like, for example, UNAIDS really supports and advances the rights of sort of vulnerable populations. And I think that's very important. In many global health organizations, at least, you will find they really try to include, and they sort of are premised on providing a voice for the most marginalized.
So we're in a presidential cycle, of course.
We are.
There's, certainly the Affordable Care Act has gotten a fair amount of play, but what other kinds of sort of health promotion and ways to address health disparities do you think are being left off the agenda?
Wow. Well, I think there's certainly the Affordable Care Act and what happens next domestically. I think issues are percolating, so drug pricing has come up. One of the challenges is the United States pays a great deal for prescription drugs, more than any other country in the world. So there's the issue of sort of, is even our health system that we have in this country sustainable in the long run? And then also sort of in thinking about what are our global health priorities in terms of, we know with infectious diseases, they will sort of come into the United States. Well, how do we focus on prevention and global health promotion as opposed to sort of national security issues? And I think, just in general, I think one of the things is really sort of fostering a culture of health. I think the First Lady, the current First Lady, sort of with her Let's Move campaign, it would be great to see sort of a continuation of that and sort of the next cycle, and really think about not just reactive, but more proactive approaches to health.
Well, we've got just probably a minute left, but I couldn't let you leave without talking just a bit about Zika, which is the top of everybody's mind these days. What should we be doing? What shouldn't we be doing?
So what shouldn't we be doing, I think, is don't panic, keep calm, and carry on. In terms of what we should be doing is follow sort of the advice of I think, our leading scientific experts. And right now, I think our top voices tend to be coming from the National Institutes of Health and the US CDC. And we really should be focusing on responding to the crisis in the countries that are affected in Central and South America. I think that's the best way to support their response efforts. That's the best way to protect ourselves. If we can sort of, and the other thing is also dealing with these mosquito populations. So.
Well, very good. We'll have to leave it at that. Susan Kim, thank you very much for joining us. Our viewers, we'll see you next time on International Focus.
For information about the Institute of World Affairs and its many programs, or to become a member of the Institute, call 414-229-3220 or visit us at our website,